We've all heard them, those home remedies passed down through generations. While some hold a grain of truth, many are myths that can do more harm than good, especially in emergencies. This essay debunks common first aid myths, providing you with accurate information to keep you and your loved ones safe. Remember, when in doubt, always seek professional medical help. Many believe that applying butter to a burn soothes the pain and aids healing. This age-old remedy has been passed down through generations, often recommended by well-meaning family members and friends. The idea is that the butter creates a soothing barrier over the burn, providing immediate relief from the pain. However, this is far from the truth and can actually cause more harm than good. This is a dangerous myth. Butter traps heat, potentially worsening the burn and increasing the risk of infection. When butter is applied to a burn, it forms a greasy layer that prevents the heat from escaping. This can cause the burn to penetrate deeper into the skin, leading to more severe damage. Additionally, the fats in butter can become a breeding ground for bacteria, increasing the likelihood of an infection. The right way to treat a burn is to immediately run cool, not cold water over the affected area for at least 15 minutes. This helps to dissipate the heat and reduce swelling. Cool water can provide instant relief and prevent the burn from getting worse. It's important to avoid using ice-cold water as it can cause further damage to the skin. Don't apply ice directly to the skin. Ice can cause frostbite and further damage the already sensitive burn tissue. Instead, focus on cooling the burn with water and keeping it clean. After cooling the burn, cover it loosely with a sterile bandage. This helps to protect the burn from infection and keeps the area clean. Make sure the bandage is not too tight, as it can restrict blood flow and cause more pain. Finally, seek medical attention, especially for severe burns. Professional medical care is crucial for proper healing and to prevent complications. If the burn is large, deep, or causes significant pain, don't hesitate to get help from a healthcare provider. Using rubbing alcohol to cool down someone with a fever seems logical. After all, alcohol evaporates quickly, creating a cooling sensation on the skin. However, it's extremely dangerous and should never be used for this purpose. Alcohol can be absorbed through the skin, especially in children whose skin is more permeable. This absorption can lead to alcohol poisoning, which is a serious medical condition. Symptoms of alcohol poisoning include confusion, vomiting, seizures, slow breathing, and even unconsciousness. Instead of using rubbing alcohol, focus on safer methods to reduce fever. Keep the person cool and comfortable by using a fan or cool compresses. Dress them in light clothing and maintain a cool room temperature. Avoid heavy blankets or clothing that can trap heat. Encourage the person to drink plenty of fluids to prevent dehydration, which can worsen the fever. Water, clear broths, and electrolyte solutions are good options. If the fever is particularly high or persists for more than a couple of days, it's important to consult a healthcare professional. They can provide guidance and determine if further medical treatment is necessary. You see it in movies all the time, a swift yank to set a broken bone. In reality, attempting to set a broken bone yourself can cause further injury and complications. The right way: immobilize the injured limb using a splint or sling. Seek immediate medical attention. A medical professional is trained to set bones properly, minimizing pain and ensuring proper healing. Removing objects from the eye can be a delicate process that requires patience and care. While it's tempting to remove a foreign object from your eye immediately, it's important to proceed with caution to avoid causing further irritation or injury. If the object is more than just an eyelash, such as a piece of debris or a small particle, trying to remove it yourself can lead to more serious damage, including scratches on the cornea or infections. The right way to handle an eyelash in your eye is to try blinking rapidly. This natural reflex can help to dislodge the eyelash and move it to a corner of your eye where it can be more easily removed. Alternatively, you can gently flush the eye with clean water. Using an eye wash station or a bottle of sterile saline solution can help to wash out the eyelash or any small particles that may be causing discomfort. For anything else, especially if the object is embedded or causing significant pain, it's crucial to seek medical attention. Do not attempt to remove it yourself, as this can exacerbate the problem. A doctor has the proper tools and expertise to safely remove the object and treat any potential scratches or infections that may have occurred. They can also provide you with advice on how to care for your eye as it heals. Inducing vomiting after poisoning. Inducing vomiting was once common practice after ingesting poison. However, this can be harmful, particularly with corrosive substances. The right way. Immediately call your local poison control center or emergency services. They can provide specific instructions based on the substance ingested. Using heat on a sprain. Applying heat to a sprain might feel good, but it's counterproductive in the initial stages. Heat increases blood flow and swelling, potentially delaying healing. The right way. Apply ice to the sprain for the first 48 hours. This helps reduce inflammation and numbs the pain. Remember to wrap the ice pack in a towel to prevent skin damage. While ointments seem like they would help heal a wound, they can actually trap bacteria and moisture, creating an ideal environment for infection. The right way is to clean the wound thoroughly with soap and water. Cover it with a sterile bandage to keep it clean and dry. For deep or bleeding wounds, seek medical attention. When someone faints, our instinct is to help them up. However, lifting them can worsen their condition, especially if they're experiencing muscle spasms. The right way is to help them lie down and elevate their legs. Loosen any tight clothing and ensure they have fresh air. Once they regain consciousness, allow them to rest before getting up slowly. Pulling out embedded objects. Seeing an object embedded in someone's skin is distressing, but resist the urge to pull it out. Removing it yourself can cause further bleeding and tissue damage. The right way. Control any bleeding by applying pressure around the object. Stabilize the object with bulky dressings to prevent it from moving. Seek immediate medical attention for safe removal. Applying ice directly to the skin. While ice is beneficial for injuries, applying it directly to the skin can cause frostbite. The right way. Always wrap the ice pack in a thin towel or cloth before applying it to the skin. Limit ice application to 20 minutes at a time, followed by a 90-minute break to allow the skin to re-warm. Using superglue to close wounds. While superglue can be a quick fix for minor cuts, it's not a substitute for proper wound care. The right way: clean the cut thoroughly. If it's deep or bleeding heavily, seek medical attention. For minor cuts, you can use superglue as a temporary measure, but monitor for signs of infection. Conclusion. Knowing the right first aid can make a world of difference in an emergency. By debunking these myths and understanding proper procedures, you can act confidently and potentially save a life. Remember, knowledge is power, and in first aid, it can be the difference between a positive outcome and a disastrous one. Stay safe and stay informed.